Meeting with the PA. And I had this meeting with the PAs on Tuesday, but we've got to make sure that we're doing the send out log, as well as making sure that the PA sign off the requisition. There's the correct order. And just want to reemphasize that because that's extraordinarily important for a number of reasons. And I was telling the PAs, you know, it's not only good medical practice, but you know, if a lab gets messed up and it's the wrong lab, or in some cases we've had over the years a lab going into another patient's name, it's just a huge ordeal to fix it. So taking a little bit of time on the front end, make sure the PA fills out that log and signs that requisition. And ultimately, like I told them, it's their responsibility at the end of the day to make sure it's correct. So, but we want everybody on the same page. So that's the purpose of this morning. And I'm going to turn it over to Joe and let him give you the heads up on it.
Okay. So this send out log should be at all the clinics. I've heard from multiple MAs that it is double the work for you guys to order it on lab interface and then come back in and fill this log out. So to get everybody on the same page, all the providers will be the ones that are going to fill out these first 4 columns really. So they probably will continue to give you a verbal and write down the tests that they want on the patient intake form. But this is just a way to get all the labs together, all the orders for that day in one place. So they write the name, date of birth, and then what test they want. If they decide, you know, to add on something else later, and you've already printed off the labels and printed the requisition sheet, that's why this next add-on test column is on there, so that last minute or test does not get missed. And we found that a lot of times you need to like cancel all the labs out, reprint the requisition form and all the labels again, because the barcodes will be all different if you try to cancel a test or add on another one. So the date here on top, I don't mind if, you know, we have multiple dates there. If you only filled out 2 lines from one day, you can just put the second date up here at the top and then continue on. So once you do print off the little barcode sticker, put that here on the right side and then initial it. And that's mostly if we have any like troubleshooting that we need to do, we can figure out, you know, who to ask to help kind of clear things up if it did get sent out in the wrong thing, and just kind of look for any patterns there. So I know the stickers are real big. The important thing really is just to get the barcode on here, and you can cut off the excess stuff so it fits on this line. Any questions about the send out log?
Oh.
All right, and then the last big thing is after you do print off the requisition form, make sure the PA signs it before you stick it in the bag. That's really just to make sure that whoever clicked on lab interface did indeed get the right tests on there. So there's a few tests that look similar, or it might be a different methodology, or might have special requirements. It's really the PA's job signing off on it to say, yes, these are the tests I want, you know, and that we're making sure we're not sending off for a herpes PCR when it should have been a herpes antibody. Like that makes a big difference. One is the wrong test and not going to catch it at all, kind of thing. So make sure the PA sign it. Get on that. And then let me just go over a few more things. We're still getting some questions on, especially when these nephrology patients come in. We've had a few of those who are repeat patients. And I think this one's probably the most confusing one. So I'm going to go over this. PTH intact. If it just says PTH intact, you order the one without calcium. I believe there is one that says PTH and calcium. So PTH without calcium is the right one to order. Notice that it's plasma collected in EDTA lavender top tube. And this collection here says to centrifuge and transport the EDTA plasma to a transport tube. So that's a couple things. One is draw a purple top like normal. It's the last tube that's going to be drawn. When you do centrifuge it depends on the centrifuge. But when you take it out of this centrifuge, you can't invert the tube at all. If you do, it'll mix up. So there's a couple ways. One is get some pickups or some tweezers if the tube's all the way down in the centrifuge and you can't grab it with your fingers, get some pickups and pull it out. The other is to stick a couple pieces of 2x2 gauze down in the centrifuge tube and then put the purple top on so that it's sticking out a little bit so you can grab it. Again, balance your tubes for the centrifuge. So if you've got a purple top that's filled up halfway with blood, you need a purple top that's filled up halfway with water directly across from it. And you can centrifuge purples and tigers at the same time. Just make sure they have a balanced tube of equal weight directly across from it. After you take the purple top out, you'll need to pipette off the liquid part of the blood, which is plasma, and put it in a transport tube. So this transport tube right here comes in a variety of colors. So don't put it in another blood draw tube because that'll mess the specimen up. You want to put it into a plastic tube, preferably a screw top tube. Those you don't need to tape on because they're secure. If you put it on a pop top tube, you might need to tape it on. So I think right now there's like plastic tubes with yellow tops, green tops, and blue tops, and light purple. Again, a transport tube is a transport tube. There's no additive in it. So the plasma, you get a pipette, and we have regular size pipettes should be at all clinics. You don't need to use the little baby ones that you use for the Sophia antigen COVID testing. Once you pipette it in, it's really important that you label it as EDTA plasma, because plasma and serum and urine and all look the same. If you just label it as plasma, they don't know if it came from, a purple or a green top or something else. So this reject criteria down here, if you accidentally use a green top plasma, it's going to be a reject. So it's got to be labeled as EDTA plasma on the tube. All right, so that's the most confusing one. Any questions on that one there? If not, we will.
Sorry, I have one question
Yeah.
about the alternative specimens.
Mhm.
Are we allowed to do the 2 ml frozen serum for that test? I know that's not really the point of what you were saying, but do you see where?
Yes, that's a good point. Yeah, for this one you can. I don't know if LabCorp is a little bit different, but yes, you can. The important thing to note here is, so there's a couple like universal rules. One is that every tiger top or red top or really any serum tube has to sit to clot and has to get centrifuged. There are 0 circumstances where you do not centrifuge a serum tube. And then to follow that, there are 0 circumstances where you would put that tiger top or red top into the freezer. So to send off frozen serum or plasma, you need to transport it to a transport tube. So never put anything with a gel barrier in the freezer.
Got it.
So this is kind of confusing because it doesn't tell you how they want the frozen serum. So if you forget and send the entire tiger top frozen, it's going to be a reject. All right. We have so I did make a rap video. There's supposed to be a choreographed dance with this, but it got in at like 11 o'clock last night. So there's just the audio, and I put a little background, something for you guys here. Oh, hang on. I gotta share sound. So this is a review of serum and plasma, mostly just because we're still getting a lot of questions on what is the difference, and what's the liquid part versus the clotted blood on top, that kind of stuff. So let's see. Share sound. Okay. You guys should be able to hear this.
Yo, 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 everyone's up now. Time to get zooming. Even though right now it's 7 in the morning. My rhymes got you cheesing, maybe wheezing like asthma. Having fun learning about serum and plasma. When blood is spun down, homie, just so you know, on top is serum plasma, red cells below. Just keep in mind they both look the same in color, so to differentiate we gotta look a bit further. Tiger top or red top, just let it clot. Always centrifuge these in serums, what you got. Whole blood that's not clotted, like purples and greens. If it's centrifuged, then plasma's what's seen. This is important, so pay attention, don't slack. Just in case you missed it, let's run it back. Tiger top or red top, just let it clot. Always centrifuge these in serums, what you got. Whole blood that's not clotted, like purples and greens. If it's centrifuged, then plasma's what's seen. Hopefully that clears it up and now you're a pro. If you got any more questions, then just call your boy Joe. Wong, 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 Wong.
Okay, that was the unedited version. So
Everyone has to have that memorized before their next shift.
yeah, put it on your workout playlist here.
Yeah.
All right, so going through these, we have all of these tubes in the lab except for this top green one on the top right. So so we have these red tubes. What's the difference between these 4 red tubes here? Because we have all of these in clinic. We have the red, yellow, the tiger top, the red one that's like a more rubber stopper, and then one that's this plastic one. So anyone want to take a shot at the difference there?
Does only one have a gel barrier in it?
Both the red, yellow, and the tiger top have gel barriers. This gel barriers, this one's already spun down, but yes, that one has gel barrier and that one doesn't. So good. That's the main thing, is that these have the gel barrier and these don't. Now, so pay attention when the Quest or LabCorp site says no gel barrier serum, you have to use a red top or a serum tube that does not have a gel barrier. All right. After you centrifuge it, do you, since this is serum, do you need to pipette it off to a transport tube, or can you send it as is? Or are you calling Joe to ask?
Let's say you have to pipette it off because the gel barrier would remix since there's no gel barrier.
Good, perfect. So yeah, that's perfect. Really, the whole point of separating it out is so that the red blood cells do not touch the liquid part anymore. So yes, if it does not have a gel barrier, whether it's serum or plasma, you have to pipette it off into a transport tube. Okay. This tube on the top right, it's got lithium heparin, which is the same as this darker green color down here. Lithium heparin is an anticoagulant. So if you spin down this dark green purple on the bottom row, is it serum or plasma? Someone say plasma.
Plasma.
Yes, plasma. Now, what happens if you spin down this light green on the top right? It's got the same anticoagulant and this gel barrier. If you spin that down in a centrifuge, is it serum or plasma?
Serum.
We have 1 vote for serum. Anyone else? All right, let's go back to our wrap. So whole blood that's not clotted, like purples and greens. If it's centrifuge, then plasma was seen. So it doesn't matter if there's a gel barrier or not. The gel barrier purely separates the cells from the liquid part of the blood. What's important is if it's clotted or if it's not clotted. All right, so that's really the main difference. Doesn't matter what tube it comes in. If it's got an anticoagulant and it's not clotted, like these greens and these purples, it's going to be plasma. The benefit of this gel barrier in a plasma tube is that you don't have to pipette it off after you spin it down, because there's a gel barrier tube that prevents it from remixing and transport. Okay. And then the last thing is on this bottom right picture, just to clarify again, the plasma is going to be this liquid part on top, and the red blood cells are going to be on the bottom. Okay, so serum is going to be this liquid part on top on this red tube, and the red blood cells are separated on the bottom. Okay, so we had some confusion there. Some people thinking the serum was on top and the plasma was on the bottom, or vice versa. Serum and plasma are both the liquid part on top. It's just a matter of if it's clotted or not clotted. All right, any questions there? We can keep going over this. I mean, it just takes more repetitions, but just keep that in mind. So again, the common lab sheet, if you see any errors, let me know. Again, a lot of these tiger tops, and some of them finished it out, it didn't say centrifuge. Some of them say centrifuge, some of them don't. I should probably update that, but again, all tiger tops are centrifuge, so it's kind of implied. Okay. Running through a few more things real quick. Just make sure you're filling out all the logs daily. A CBC tube is expired 14 days from open, so make sure you write that down. And then the reagent expiration date, you should write the date in these. It's just a check to make sure that we're changing them out when we need to, but it's 90 days. And then if you can, write down the lot numbers from the CBC controls once they're changed. You can transfer them over from the month before, and I try to keep an eye on these, but if you're the one who changes it, it's a good idea to write the lot number down, what date you started it, and the expiration date that's printed on the tube, not that 14-day expiration. Same thing with the controls for COVID, flu, RSV, and strep. Once you run QC, if you can check off this box, it's super helpful. At the end of the month, we'll figure out if we need to run QC on it or not. All right, just remember we run QC once a month on strep and COVID, flu, RSV. So if you have plenty of lot number to get you through to the next month, then and a new lot comes in, you can hold off on QCing it right then. Those cartridges are like 60 or 70 bucks each, so we don't need to do unnecessary QC. If you have enough of the current lot to get you through this month and can afford to wait until next month to QC the new lot, then do that. Write needs QC on all those boxes, or that one big cardboard box that it comes in. And that's the other important thing is when you do QC a new lot, please write on there QC and the date, because a lot of times people will come back in behind you, see that it QC is not written on that box, on the individual box, and then waste 2 cartridges running QC because somebody didn't write it on the box. So again, you're supposed to look in the Gene Expert book and flip all the way to the back and see if that lot number has been run. But sometimes, we get busy and forget. So a couple different ways to check. One easiest way is just have it written on the box. The second way would be to go into the log book and look at that. All right. A couple more things. Rejection log. This should be printed off on a clipboard next to the LabCorp and Quest trays at each clinic. And so these are not instrument errors. This was all in the last email, not instrument errors, but reasons that we have to we couldn't run a test that was based on the collection method, or the blood was clotted or something like that. And so again, this is just a state compliance thing that we have to document these. So whoever is doing patient callbacks, if you are doing it for the provider and they couldn't run a test because it was sent in the wrong tube, just jot it down on here, and that way we'll have documentation. Last thing here is this is going to be next to the CBC analyzer at each clinic. But this is another state compliance thing. When you have a lab that's so far out of range that it's critical, it's just important that a provider sees it and signs off on it. So right now, obviously, all the providers kind of see the labs and it gets scanned into the chart, but the state does require us to document that it was communicated with the provider. So here you have the normal ranges down here on the bottom. And when something's really out of whack, write down date, patient ID, what result, and then what you did to fix it. All right. Questions? Also, don't apologize when you call or text me. That's usually the first thing that you guys do is, hey, sorry to bother you or whatever. It's never a bother. So just, again, that's what we're trying to provide, patients with the best care possible. Even if it's on my off day or whatever, it doesn't matter. If I pick up, I am available. So you don't need to apologize there. Don't feel bad for calling. I call Jeff and other providers all the time when I've got questions in clinic. So it's good patient care. We're here as a team. So I'm here for you guys. Okay.
Can you send us that wrap?
Yeah.
I really want that.
Post it somewhere, maybe on Instagram.
All right.
All right, guys, I appreciate y'all jumping in here. And I mean, Joe does a great job with this lab stuff, and it's on all of us to get it right. So he's not having to police this all the time. Some of it's confusing. And like I said, answer questions. I mean, we're asking you guys to be lab techs or running a moderate complexity lab, and you have been formally trained in it. So a little OJT, but it'll pay off to you, especially you guys that are going off into the field in different professions, medicine or nursing or whatnot in the future. This is a great training ground for you. You'll know head and shoulders above your classmates on lab stuff. So there is that silver lining in all these little details, but it's extraordinarily important that we get it right on a daily basis. So I appreciate everybody jumping on this morning.
All right, I'll send the recording out. You guys have a great day.
Thank you.
Thanks, bye.
Thank you.
Have a good one.